Okay, it is 11 o'clock, so we are going to go ahead and get started. If you want to just call the first item.
So the first item on our agenda is appearance by members of the public.
There have been no requests for members of the public.
And I see no members of the public. So I think we can move on to the next one. Items for information, Marita?
The first thing that I wanted to bring to this group's attention is a bit of an update about where spending on the community projects for 2025 has going, and to get some feedback about something that I'm interested in doing related to the emergent funds. So per I think our February meeting, I'd last explained that of the $2.25 million that we had set aside for spending of community projects in 2025, we had earmarked a portion of that for addressing the shelter strategic priority, some focus on marketing, which was also around a strategic priority, and then some professional development opportunities. And we talked a little bit about kind of what would constitute, how to get support around policy for creation of how emergent funds might be supported. And then I had a portion earmarked for other things related to the strategic priorities that might come up from BHCC, and there was nothing specific that came up. So what I wanted to bring to this body for discussion was the idea to go ahead and move that sort of earmarked for other things into the emergent category, so that we would have, instead of the $225,000, it would be $450,000 set aside for emergent funds. That would still keep it within the 10, I think, to 20% that we had originally talked about. So it still stays within that ratio, but it was just something that I wanted to bring to this body for discussion, to see if you had any ideas or guidance or any other thoughts around that.
Any comments or questions for Marita?
As a new person in this group, is there any additional context beyond what's in the packet today that you could provide about these prior conversations?
The prior conversation that we'd had a special meeting in February, where I believe it was in February, where we looked at some departmental policies around spending of the mental health and public safety funds. That wasn't additionally included in the packet, but I had gotten feedback from this group about what that policy might look like, about how we describe what emergent opportunities look like. We talked a lot about some specific examples would be things related to natural disasters or public health emergencies or local traumatic events, but just generally speaking, things that were not previously planned for. We talked about part of that policy was that annually the plan would be to reserve 10 to 25% of the annually budgeted funds for projects to address emergent needs within the community. And I'm trying to remember what else from that meeting.
I will add that in my recollection, the other mental health action plan funds that is being proposed to be moved were set aside for priorities that the BHCC might come up with, where there might be funding necessary or available to provide funds for projects. And I believe that part of the sense is that those aren't going to happen by the end of this year, is my understanding. That there's not been any other proposals that have come out of it.
So if I understand what you're proposing you move the other into the emergent.
Correct.
Okay. And then just looking back, say, 12 months, could you give me an example of 2 or 3 things that would, that have been paid by the emergent category?
This is actually the first year that we've had this at least called out as a specific category. I think that maybe, I suppose an example that you could give that was kind of an informal example would be when YWCA Stepping Stones came forward asking for support based on an unexpected loss of funds that they had not planned for. It wasn't like an end of a scheduled fund. It was an end of those funds kind of unexpectedly. The idea of these emergent funds would be generally for things that are still included within the strategic priorities of the mental health action plan period. But I think there are opportunities, at least as the mental health action plan exists now, there could be opportunities for things that hadn't maybe specifically been. The idea would be for the main funding sources for this to come from either the strategic priorities or something that's listed in the mental health action plan, with the intent to make sure that the funds that are available through the shared sales tax fund are put back into the community.
Cassie?
I would just further state that in the past, I think all of our projects would have been categorized as emergent needs because we didn't have the structure that we have now. And so the Bridge Academy, the Stepping Stones project, the 2 ROE projects that we approved last year, all of those would have been emergent needs because that wasn't started with an RFP from Merida.
Right.
It was started with a request from the community to this group.
I was just going to bring that up so we talked about a structure of when this meeting happens and when we do budget and what happens when things come up out of that cycle, that this was part of the conversation, that non-RFP driven, community-based driven, not in our budget approval, FAC budget and approval cycle, that there would be an opportunity if something came up, that there would be some funds somewhere set aside, acknowledging that the community and the community needs aren't going to follow along with our little FAC budget cycle. And so that, I'll cede back if you have more questions, but I'll have some too.
So just to be clear then, so that by doing so, would those appropriations still come before this group? Or are we consenting that this bucket would simply just be available to dispense according to staff?
It's my understanding that none of those come in front of this group. Those decisions are made through the county's process.
Okay. Thank you.
Yeah, Kevin?
So this, whoops. I thought I got it. I'm still new to button pushing to talk. So acknowledging that this is our first go around and our first experience of it. So a question I raised back then is, do we anticipate moving this money around a bunch, or do we imagine that we're going to fund this bucket and leave it funded? And so part of my answer from when we talked about having an emergent bucket is now we're planning to move it out of that bucket. Are we going to plan to refund it next year? So in other words, if we're going to have this other bucket and we think we're going to need another bucket every year, why are we funding it one year, taking back out to fund it again next year? Or do we just assess, hey, is 10% too much? Should we, shouldn't we? I think we need to be asking ourselves those questions, considering this was the first go around.
Sure.
Should it be 5%? Should it be 2%? Should it be 20%? I don't know the answer to that, but
Right.
we didn't get anything this cycle. So I think we need to continue to ask ourselves those questions and whether or not it makes sense to just leave what's in there now. And that way next year we don't have to fund the other bucket. It's already full.
I guess part of what I think longer term is important about kind of this emergent funds bucket is the ability for these shared sales tax funds to remain agile and flexible when it comes to responding to needs a little bit more quickly. I think that utilizing the mental health action plan and the structure that we anticipate to continue to be seen by the mental health action plan as driven by the Behavioral Health Coordinating Council is important. It's important that the initiatives that are funded by this sales tax fund are underpinned by consistent policies, procedures, and expert subject matter expertise. But part of what I've been learning through the last year is a need for us to also add some additional responsiveness to these funds. So I agree that annually, I think it'll be important for us to assess what percentage of what we set aside for community projects, period, is flexible in that way. I think that will be important. I think that because of part of why I'm bringing to honor that ongoing process, part of why I wanted to bring that to this body here is because of is to make sure that we are able to spend as much of the money set aside for 2025 as possible. And given how quickly Behavioral Health Coordinating Council was able to expand on the different scopes of work that the different priorities we're going to have and what additional things did not come out of that, this was part of me saying that this is what we originally planned for, but our community deserves this money, and I think that there are lots of good ideas that come from the community. So I did want to part of me bringing that here was to kind of honor that we want to keep this flexible, and that it's not meant to be a set amount that we're setting aside and saving necessarily, but an amount that is meant to be flexible to the needs of the community annually. And I do think that it's a good idea for us to annually kind of examine that, and I do anticipate that in our routine August meeting coming up that we will be able to look at as I'm continuing to work through the budget and I'm able to present you guys with what I believe we can set aside for community projects for 2026, that we can have a salient discussion about what percentage of that would make sense for us to set aside for 2026 and to continue to have that conversation.
So if I'm understanding, you want to move it now, almost July, and put it back in August? No? Or did I miss that?
We would be planning to spend this money through 2025. So this would not be money. This is me making sure that we're not saving money for next year necessarily, and making sure that funds that we had planned to spend in 2025 still get spent in 2025, just through this emergent opportunities process.
So I didn't ask a very good question. Let me try again. So for the 2026 budget cycle, you imagine coming back and asking to fill the other bucket again?
It might be useful, based on what I'd previously put forth in the procedures. It's less about saving money for emergent opportunities and making sure that there is a portion of the money that is more flexible than what we set aside. So money that would be, what I would come forward in 2026 would be me confirming what percentage of what we are planning to spend in 2026 to be a part of those flexible funds. And I would anticipate that annually, we would likely, I anticipate that this would likely be an open application process that would be available annually. So this would not be a bucket of money that this group or that my department is sitting on waiting for someone to tell us when there is an emergent need. This would be money that annually would be available for people to apply to maybe once or twice a year, or maybe in the middle of the year.
I think there might be a need to clarify, because I don't believe that you're getting what his question is.
Probably not.
No.
What you're asking is whether or not the other MHP bucket will exist for 2026,
Oh,
correct?
Yes.
gotcha.
So in other words, pulling it out, putting back in, pulling it out, putting back in,
Right.
pulling it out, putting back in.
Sure.
So there's a number of follow-up questions depending on what that answer is. One, I kind of preceded to say, let's assess how much we really need to spend or put in there if we're really not spending it much. Or to your, I think what I heard was a clear process of how we might use those flexible dollars. So I think that's great. A next question is do we have something that we want to spend this money on now? So you want to move it to try to get it spent, but do we have anything to spend it on?
So explain to him the difference of the two strategies. So if it's in the other MHAP priorities bucket, then that means that the work groups have identified a priority and you have to send out an RFP.
Right.
I appreciate that, but you want to move it to spend it? Is there a project to spend it on?
These would be projects that would be coming not from our priorities, and we would be looking for people to apply to these funds.
Okay, so when does our budget end for 2025?
Yep.
Okay, so between now and December 31st, you want to move this to make it available for projects, but we don't have any yet.
Correct.
Okay, that's great. So how much money do we still have available to spend between now and December 31st without this money?
It is without this money. Just the $225,000 then.
Without adding $225,000,
The,
how much money is in the services bucket to spend in the budget remaining for 2025?
it would be, yeah.
Sorry, didn't mean to make you do math on the spot.
I guess I can answer your question two ways. The parts earmarked under shelter marketing and professional development have been earmarked for that purpose, and we're moving forward with projects to spend that. If you're asking from a more practical perspective, how much of that has been contracted to spend, that is more or less why I got out my calculator. But so yes, it would be if you don't include how much money is left to spend, if you don't include of the 2.25, it is about the 420. It is the 420,000 that is not. Thank you, 450,000. That is not specifically earmarked for a large RFP project driven from the Mental Health Action Plan and BHCC.
Thank you. So if we move this, we're talking about 675,000-ish. Not going to hold anybody to, or am I misunderstanding the math? That's what I want to make sure I clarify.
Go ahead.
I don't think that the amount that's available to spend is going to be different. What they're saying is, because of the two buckets, one is for a formal RFP process that the work groups will put out, and one is just a bucket where the community can come with proposals and it's accessible. And so what they're trying to do is move it into because we're still finalizing the mental health action plan rewrite, because we may not be in a position to put out an RFP to spend it in 2025. They just want it in the emerging bucket. I guess my question is, we would be having a meeting for any proposal that would be coming forward. And if we exceed this emergent need, we could move it from that obligated bucket at any point. It doesn't have to be right now. My question, I guess, is do you feel there's an advantage to moving it into the emergent need bucket as we explain to the community it's here?
I suppose the only advantage that I would see of formally increasing that amount is that it could change what kinds of proposals people come with. if I don't anticipate additional detail coming from Behavioral Health Coordinating Council about spending needs for 2025 at this point. So if that $225,000 that was roughly earmarked for other larger RFP opportunities was not moved into the emergent bucket, it probably would not get spent this year.
So to follow up, I appreciate the clarification. I understand the difference between the buckets though. So, but what's not committed in our 2025 budget is $675,000, if I understand that right. Whatever the bucket is where it's currently residing.
450.
450.
And that includes this 225. So total, that's what I was trying to get to. Total is 450,000 of this 2.25 million is uncommitted.
Right.
Okay. And then I was going to ask that question. Does it matter if
Perfect.
we move it now or later?
Yeah.
Thank you.
Well, and to clarify, this body wouldn't probably meet. It would be up to the county board at that point.
If we wanted to move
Correct.
more money, yeah, if we wanted to, if there was a need that came and we anticipated that we would need more than $450,000 for 2025, that would require a budget amendment to pull more money into this, and that would bring this body together, correct?
Right, and I apologize, I'm just trying to clarify, but if there was an emergent need more than 225 and we didn't move the other bucket over, would that bring this body back together then? Yes. It would, okay, I misunderstood then. An additional thought or question, we know that there are quite a bit of chaos, right, in terms of federal funding and spending and so forth. Is there any thought around the idea of having the money readily available in emergent needs connected to the need to be responsive if there are drastic changes in the federal budget pieces?
That was definitely a part of the intention of me wanting to make sure that I had a conversation about possibly expanding what the emergent funding was available within the budget that we have. So I'm interested in expanding it, but not adding additional funds. It would just be funds that were not, that we did not have a specific plan for. But that is definitely part of the reason, is given the context of what has been happening this year, to make sure that we're able to create some sort of application process this summer for people to apply. And my department has a little bit more work to do as far as clarifying what that would look like, what that application process would look like. But it would be within what is established as far as kind of the amounts in the buckets that we have here.
So if we're not going to be doing formal RFPs, how is it going to be communicated to the community that this money is potentially available?
It would likely be in some sort of notice of funding opportunity that would be published. So we would need to, my department is starting to do that work on our end as far as what an application would actually look like and those criteria, but it would likely be something that we would communicate through media lists and social media and through email to make sure that people are aware of when that money is available, when people can apply, when the due date for applying would be, those kinds of things.
One point I might suggest is if we're talking about emergent needs, due dates are probably not going to be a useful piece.
This is a new strategy that we have not formalized before. And so I guess as we were envisioning this in some of our work groups, we were thinking of this more like foundations do, where you have a set amount of money set aside, and then it's a first come, first serve basis for like a foundation with these emergent needs. So if it is truly an emergent need, one you couldn't plan for,
Right.
and one that a community agency brings to this, to the BHC, or I guess to the county board, then I think that would be not a due date scenario
Yeah.
necessarily, but certainly Marita and her staff would have to have like the criteria set and when it's open and available, when they're ready to receive at the beginning of the year, and how much is available for certain projects. So I know in some foundations, they'll say, we have, $500,000 available, but each project has a cap of 20,000 or 50,000 that they could request. And so it wouldn't be that just one project would get all the money if they're the first one to get their proposal in the door. There would be other criteria or caps available to be discussed.
So were it not for the, as you describe it, the chaos of what's currently going on with funding, would we be having this conversation today?
The intention was for us to, we were talking about having emergent funds set aside to allow the funds to be more flexible before our meeting in February. So I do believe that we would still be having this conversation. I do want to make sure that in an ongoing way that the shared sales tax fund can remain flexible to the needs of the community.
And just to kind of summarize my understanding, I mean, we do have that, it looks like today, but the request is doubling what's in that account, basically.
Yes, to move funds that were previously set aside for larger requests for proposals that were driven by the priorities of the Mental Health Action Plan for 2025, and moving that earmarked part of funds formally into those emergent opportunities.
And what was your thought as to why you didn't have folks that were tapping into this other bucket?
It's not previously, there's not been consistent processes on how those funds have been made available. So this is really the first year that we've gotten close to any sort of formalized procedure for it.
So in just trying to kind of assimilate this, it sounds like, we feel compelled, move it, or we could lose it. I mean, and I'm kind of feeling like a sense of urgency, coming around that aspect, as opposed to maybe a more strategic aspect. I don't want to mischaracterize that, but I'm just trying to connect the dots as to why now, for something that we don't necessarily know will or will not happen. And, I mean, again, this is our one-time opportunity, it sounds like, to have this conversation. And
That's true. So this is actually this is actually a discussion, and this was not actually a specific action item for approval. But this discussion was meant to bring exactly these kinds of things, so that we can have kind of a strategic discussion around what procedure particularly should look like for 2026, and to help guide my staff in what the policies should look like around that.
Specifically to the question of why now is really the answer is this, we should have been having these conversations years ago about how to get the money into the community and how to get communication to our community partners on how to access this to improve services. So we're having the conversation now because it hasn't been had before. But the truth is this money belongs in the community. It was collected for the community, and I'm in favor of making sure that we get it back out there.
Kevin?
If you have something to say, by all means, go ahead.
I was simply going to say how I am thinking about this situation. You're right. These conversations have not been had over time, and a process had not been really firmly developed. I think the additional issue is to make these funds available to providers in the current bucket would require a priority, an RFP, and a formal process, which will take time. These dollars are earmarked for 2025, right? So if we want to say we need to make them available to the community, then we need them available in a bucket or a format that is more easily accessible by providers and other types of systems that might want them. And that's why we're having it now as well, is we've got 6 months left, pretty much, to the rest of the year. And if we want to make these funds available to the system and the community, then this is how we make those available so that they actually do have a potential to be spent.
First, I appreciate the acknowledgements and the urgency. You know, I've been a let's get the money out the door to the community advocate, certainly here. And partly how much do we have between now and the end of the year, and what's the likelihood we're actually going to get it out the door, but for some effort to communicate with the community that would likely use these, that we actually in fact have it. I don't know that the community that might use this knows, because I just had to ask, so how are they going to know how much money's here and it's available and that there's some kind of a process?
Yes.
So number one, I'm fine moving it today. Or soon, whatever you need. I'm okay with that, but we have to communicate it and get it marketed. And then I want to understand the process better, because that's also going to be important for communicate and understand what our role is in that process and what the decision making in those now more flexible requests and the like, because I think if it's speed we're after, right, and we have a role, then we have to figure out how to be nimble in these meetings to be making sure that we can say yes or no quickly in the process. I'll pause and let that sit, I guess.
So if I could just add on to that, no, I really appreciate what you just said, and in that quest for speed, you know, how are you factoring in with process, the balance to ensure this isn't just going out there without a related cause and effect, if it's impact and it's leverage to make a difference in this community.
Absolutely, yeah. I think those are really important points actually related to what our action item is and how I would propose to make sure those things happen as well.
So you just took the words right out of my mouth. Those are absolutely great points. I completely agree, and I think that takes us to our action item, number 4. So Marita?
So our action item for today is I'd like to request the recommendation of this body for a budget amendment for a total of $52,000, which would support a grants program manager position in my department. This would include the salary and fringe for that position for about the end of July, which is more or less the earliest that we could probably hire this person through the end of the year. It would include some workstation costs as well as creating an addition of a wall so we could create an office for this person. But what I have learned in trying to do this is that creating the evaluation process, the contracting process, the contract monitoring process is a lot of work. It's a lot of good work. But as a department head, it's something that I've been split to do, and I think that an investment in a person who would be focused on getting these community projects out is a really valuable investment to making sure that we are getting funds out efficiently, but also having a very close eye on quality and outcomes. So this person would generate and manage those grants from the behavioral health community projects portion of the shared sales tax and would make sure that those are dispersed and managed effectively. I've included the job description for this position as well to give you an idea of what kind of what we would be looking for. That has been based on similar positions that exist in other parts of the McLean County government, as well as consideration of the different skills that I've learned are necessary for such a position. And based on those skills, we utilize the standard county code to determine what that pay range would be and included in fringe, getting our total to the $52,000. I'm happy to answer any questions that you might have about that.
So, I mean, really, so when I read your packet, while we're talking about right now, real time, and, the amount is 52, in reality, we're talking about bringing on a full-time permanent employee. And so over a 5-year period, we're talking about a $500,000 investment. So, I'm trying to reconcile this with the conversation about how do we ensure the most money possible gets to the providers who need it. And it's been wonderful to have the opportunity to sit with them, to learn from them, and to see, the challenges that they are facing. So, and we were talking about specifically administering the emergent bucket, is that correct?
Yes, so this person, that's what we had been talking about. This person would manage not only the emergent funds, but would manage the creation of the RFPs for the standard, for any of the community projects funds, not just for emergent opportunities.
I guess at first reaction, I have a little bit different feeling about this one than the other one, where we're talking about, the balance between agility and accountability. And I know I can't speak for my colleague here, but I know I have some folks right down the hall who are very interested, in the outcome of these conversations and their connection to other conversations that are going on. What other alternatives have been explored? For example, contracting out this service, at least for the near term, during this period of tremendous uncertainty, without bringing on what would be in this moment really a $500,000 decision and then some when you factor in, the escalating cost of that over the next few years.
I haven't considered specifically contracting. Part of what brought us to this decision is also kind of a historical look over what this role, what the Director of Behavioral Health Coordination has historically done, and what the group, what that position has been capable of, looking at the wide variety of people that have filled the role. It's also a measure of sustainability for the position. I'm the 4th person who has had this position in the last 6 years. And I think that part of the move to create this position is born out of a consideration of the standard sort of department head responsibilities that include management and all of those pieces for this as like a standard county department head, a consideration of the additional responsibilities that the director has as the BHCC clerk and the administrative support that they provide to BHCC. So the position was created with those pieces in mind, but consideration of contracting for a position is something that we could certainly think about based on how Behavioral Health Coordinating Council is shaping the Mental Health Action Plan, and based on sort of the longer term goals around flexibility and responsiveness of the funds. I think this is a worthwhile investment. I do, of course, have also want to be very considerate of how my department is structured organizationally, and have been doing a lot to involve, to delegate and kind of shift responsibilities based on the skills that are the skills and talents of my current department. But the creation of this position is in consideration of that.
May I ask a follow-up? So in consideration of something like contracting out temporarily, as I read the job description, it sounds as if this role is one that would have an ongoing relationship with grantees. Can you help me understand how that, like, I hear the now, right, is setting up the RFPs, the process, et cetera. What does that ongoing look like? What are you envisioning?
Sure. If this person, in kind of a longer term vision, this person would be would be a partner with our different grantees in creating goals and outcomes that align with the Behavioral Health Action Plan as we've been growing it, and help to keep accountability and challenge our grantees to make sure that that the projects that come out of the Behavioral Health Action Plan and these funds are following those innovative and yet grounded strategies that the group at BHCC has identified as been so important. So I would anticipate a lot of it is going to be relationship building with those different grantees, including helping to kind of build those, building skills with them, with different organizations in opportunities that they might have for state or federal grants, because they'd be working with someone on creating those outcomes. So we've certainly got several community members and people who have historically gotten grants who have worked with the grant process before and kind of have that familiarity, but I also anticipate that this person would be able to help different organizations to grow a capability to apply for other grants over time, working with a liaison. I would hope that this person would kind of help to grow those skills in organizations that maybe don't have all of the resources to devote to monitoring grants.
I think that Marita is trying to be modest and professional, but I will cut to the chase. There is more work to do in her position than can be accomplished by one person. And so by creating this position, we are putting someone in that role that can be dedicated to the community aspects of this fund, as well as the BHC, the requests of the community through the BHCC and the Mental Health Action Plan. When we were doing our internal look of how can we be more responsive to McLean County, how can we get these dollars into the community in a meaningful and innovative way, part of that analysis was noting that she has more work to do than can be accomplished by one person. And so that is part of the reason for this request at this time, is that if we want to do everything that we have acknowledged in the Mental Health Action Plan, then we need resources and people who can do that work.
Thank you. So I'm sitting here absorbing this one. I am not hesitant for us to get resources. I fully understand that, but I'm at a disadvantage coming into this conversation because I don't know what you know. I heard you speak to that just now, but you followed some kind of process, and I certainly don't want to get into doing your job, to be clear. I don't want that level. But this is the first time we're understanding context. Mm-hmm. And I don't know all you're managing. I don't know the workflow. I don't know any of this until we see a proposal that says, I need somebody new. And so for things like this, generally, I'm going to be looking for more information to try to understand the context of what's happening, to why this isn't part of your job. Mm-hmm. Respectfully, not suggesting that you should be able to do this. I just don't know.
Sure.
Is my point.
Yeah.
But we're being asked to vote on something that we don't understand is a problem.
Sure.
And I don't have much context until just this moment in time. Am I making sense with
Yes.
that?
Yes.
So I feel like I'm coming into this disadvantage and going, hey, make a decision, but I don't have enough information really to know.
Yeah. I mean, the short answer is what you described. Creating these opportunities is a part of my job. It's just not the only part of my job. Right. Which is part of why we're bringing this, because I think we've seen over the last years the importance of being able to move on these funds in a clear, fair, transparent way, and based on the work that I've done, analyzing what we've done historically and including kind of where we want to go now, right? We've learned a lot over the last 5 or 6 years that this department has existed and BHCC has existed. And so not only am I functioning as a department head with a team of about 10 or 11, which of course includes, there is a program manager for the McLean County Fuse program, but our department oversees a direct care program, help with the system of care grant. BHCC, of course, is a big portion of what I do as well, providing that systemic support, that strategic guidance support. Obviously, this year is a little bit more busy with the revision happening, but even without the revision, a lot of the work, based on before we started the revision, I do anticipate seeing what additional work is needed for the work groups also appears to be really important to help make sure that there's that through line between all of the work groups and understanding that. This portion, I think, is a really important part that deserves a specific skill set. And if we want those funds to be, part of what has made it difficult this year is just the catch up from BHCC being paused. But if we would want for 2026 funds, if we would want some sort of notice of funding opportunity or RFIs to be released for 2026, those are the kinds of things that would need to be happening soon so it could be released in October. And just based on the rest of the year and how delayed I've been in trying to get these opportunities out for 2025, without someone who is able to focus on that, I would anticipate that we would just still continue to be behind and funds would not be able to get out into the community as quickly as all of us would like them to be.
I would just say, having watched the process for so long, one of the reasons that it is so hard to get the funds out right now is because the amount of energy that gets put into monitoring and making sure that we are approving programs that are appropriate, and that they will show a sense of impact. And because we do want to be able to show how this is impacting our community, how it is improving our community and the care that we get. And so to do that kind of dual purpose, to expedite the funds getting out, but also to do that kind of quality control management, I understand this is beyond kind of the bandwidth, and that's what you're kind of bringing to us. If we want to do a slow roll, we can continue as we are, is my understanding. But if we're looking to move that process into kind of the initial vision for this program, that we do need somebody who can expedite, is my understanding.
Oh, go ahead.
No, please.
How many projects, so I'm going to call this project management to make it easier for me, if that's okay with everybody. Okay, so we're all using a common language. So how many projects are currently under management that this person would be responsible for?
If this person started
Today.
in July, this person would be managing 7 contracts, 7 to 9 contracts just under the RFP, just under the planned projects, not including emergent projects. There would be 7 active contracts that this person would be helping to manage
Okay.
For 2025.
in 2025. Yes, I'm currently managing probably 5 or 6 contracts or things that are going to be contracts. And then the professional development piece probably has 3 different, the professional development project probably also has at least 3 different contracts that would be underneath it.
Just to follow up, you said you imagine, so some of those in the count aren't yet, certainly the 3, but some of you said 5 to 6 are not in place yet.
Yes, so there's 4 contracts actively in place right now.
Okay.
And then we'll be releasing an RFP next week, and I anticipate two more, at least probably one more RFP, and the other one might not end up needing an RFP, but would just be a contract underneath the professional development. I am counting the shelter project.
So for current and up to 2 or 3 more. Is that, did I get that right?
Yes.
Okay.
So I guess, and again, context, I mean, local governments all over this country are trying to figure out how to make the math work, you know? You mentioned, 10 or 11 people that currently are in your department, but perhaps missing the specific skill set that you're looking for. What programs do you have in place to upskill current staff, to provide development plans that, for example, if you were to, retain someone to help you in this crunch period that you currently have, but then you could provide opportunities to actually grow the leverage of your existing staff through intentional development to close those gaps?
Yes, absolutely. This year, I've done a lot of investment in staff development, whether it's something small in a Canva class or different Excel training. I do have the staff member. Part of how we structured this job description was also after our SOC program manager, who has really focused these skills in a more focused arena on just one grant, on managing an external grant that we got in. But I've been working hard on utilizing either interns or other opportunities to allow staff to shadow different opportunities, delegating more skills, including some of the RFPs. So I've been working hard to take things off of my plate and put it on other people's plate, and to help grow skills, whether it's in management of people management and having direct reports. The county also just started a county leadership program that I recently finished, and that I anticipate that I will be able to send other staff members to continue to grow leadership skills. So that is something that's extremely important.
And I apologize. The question I intended to ask is different than how it must have sounded as you heard it. I'm talking about specifically intentional development to build skills in a specific alignment to a gap that you have, AKA in this position. So as opposed to questioning in any manner, your general leadership and the
No, I'm
great
sorry,
work you're
yeah.
doing to grow and develop the capabilities more broadly of your people to bring out their best.
Right, no, and we have been, certainly during evaluations, we've been working on goals together, and whether it's kind of matching what kinds of skills the employees want to grow, and the kinds of skills that I've seen that the department needs. So internally, we've certainly had those conversations, and are looking into different opportunities to provide that support both internally and externally.
So, and as I understand it from the documents that we were provided, typically this person would be primarily involved in that emergent bucket. Is that?
It would be both. It would be someone who is managing this is a person who would be helping to establish what the process is for grants that come out of our department. So it would not just be the emergent funds. This would also be the person who is creating the RFPs based on the feedback that we get from the Behavioral Health Action Plan, and creating the contracts, helping to kind of firm up the evaluation process that we've already started, that we piloted with the shelter project, building that body of evaluators locally, creating the different rubrics for how those evaluators would evaluate those projects, managing those evaluators. So it would be bigger than the emergent opportunities.
So, no, I appreciate it. I mean, my concern is just kind of where I started. I mean, that we're really talking about a $500,000 decision over a period of years, and not just a $52,000 decision right now. And I personally still feel a bit ill-equipped to feel that I'm being responsible and also, looking out for, the cost structure associated with that,
Sure.
the legacy cost.
I do genuinely feel that pulling these funds aside for this position will help to ensure that the persons in this director position are able to maintain, are able to stay in this position for a longer period of time. The turnaround that we've had in this position has been for a lot of reasons, but I do having a year to kind of examine what the position looks like, and even with all the changes that I've made, it does feel that long-term having all of these responsibilities under this one person is also not a sustainable way to utilize that money effectively.
I certainly have a lot of empathy for that. I mean, there's certainly a lot of roles, and yours is a great example of one where I'm sure you feel a huge weight on your shoulders with that. I just wonder, and what would be helpful to me in another conversation, would be what can be done to remove things from your responsibility that now that more and more maturity is being developed, maybe are found to be less effective than others, things that maybe we could stop doing. I mean, restricting work in process is super important, and sometimes what we forget to do is to think about what we're not going to do and create a boundary there to enable, people like you to focus in areas where you're not only passionate, but where, to your point, there's a value proposition in return in the community.
So in all the discussion about potentially creating training for other employees, maybe the other question is there a bandwidth availability in other employees to take on some of these roles? Having watched the BHCC, my guess is no, but that would be a question I do want to ask is, as we're talking about trying to maybe avoid the hiring of somebody to do the work, is there the potential for being able to do it within the department, even if we upskill? Is there bandwidth for it?
It is a combination of both experience and bandwidth. So there is a bit of a balance of maybe if this project, if there's less focus on one project, maybe there is more space. So at this point, I think there is bandwidth, but there isn't the level of depth and experience, particularly for these skills around grant management, and that does not in particular, where the experience does exist, there is not bandwidth.
Excellent. Okay.
Thank you. Making sure I understand scale. There's a lot here in KSAs and pre-quals, and it's very thorough. So part of what I hear is in skill sets needed. I want to go to that for just a minute, make sure I understand what we're trying to find. Is certainly administrative skills, because you're talking about authoring RFP standards, and so certainly a level of knowledge and skills associated with that. Probably not too unlike what you were talking about in your foundation example, I would imagine. But then also more operator level, more frontline level of detailed interaction and tracking budget review from grantees and the like. Or are you imagining that there's going to be support staff supporting this person from the others in the department? Or is this one task's the sole responsibility of this one person, would you say?
I would anticipate that other staff within the department would be also supporting the staff member. Between my office manager does a lot of accounting support, so this person would be working closely with my office manager to get a better understanding of the financial tracking system and working with them, as well as our administrative assistant would also be probably helping this person as far as helping with scheduling things and those kinds of things. So I do anticipate that this person would be getting support from various parts within the department, as well as between myself and the assistant director as well.
I was hoping you would say that. So then we were talking about training and upskilling for my counterparts here. Is that an opportunity for cross-training within the organization?
I think so, particularly while my SOC project director is limited, 100% of her time must go to SOC projects. I think that there are definitely opportunities for, especially once the kind of the foundation of the evaluation process gets established. I think that this person will have lots of opportunity to work collaboratively with various parts of the department and to help to cross-train so that we have flexibility for absences and those kinds of things. And that the department can collaborate more effectively to make sure that the complex array of departmental projects can be met.
For me, feeling more equipped in this kind of a decision would be helpful to understand how many people are we employing and what are they doing? Because I don't have a handle on that. I would have guessed 6 to 8, but I would be wrong.
Right.
And I'm theoretically read in. So that would be helpful for me as part of my role in this is to know that on an ongoing basis, whether that's an annual kind of report to us in addition to, I know we talked about budget report out
Sure.
at the end of the year, that kind of thing, but how many people and what they're doing for that. Certainly, to level set this conversation for me, knowing where they're going and that they're getting used and that there's an ROI is obviously critical. And so that's what I'm getting questioned about in my role, my night job. On the council is where they're going and we don't see them and how come more's not happening. That's effectively the tough messaging that we're hearing on our side. So this role to help that answer those questions and ensure that those things are happening, I'm supportive of.
I just have a couple of things. I think if I'm reading correctly, please let me know if I'm wrong. It also sounds like this individual is envisioned to be maybe the primary one interacting with Dr. Beck around data and outcomes. So, because it mentions collecting data and analyzing it.
Yeah, I imagine it would probably be a little bit of a combination. It's something that we'd have to kind of collaboratively figure out. I do anticipate that collaborating with Dr. Beck would be a really good use of that. The consulting with Dr. Beck on what might be included in monitoring as far as what gets included in a contract, about expectations could be very useful. I still anticipate that since Dr. Beck's contract is for anything coming from the Mental Health Action Plan, and that still covers broadly my department, I still would anticipate that I would continue to have kind of bigger picture needs to interact with Dr. Beck, and he would continue to support things like the FUSE program. But I do think that there's very advantageous ways that this role could interact with Dr. Beck in leveraging that data.
And that's what I was thinking I was reading, was more around that this person would be gathering the outcomes and the data and then interacting with Dr. Beck around what that looks like what the results are saying.
Yes,
right?
I think that there are great ways that they could collaborate with Dr. Beck as far as what reporting looks like, especially within that broader context about how we might communicate to both BHCC, to this group, and to the community about what really the projects that are funded by the Mental Health and Public Safety Fund have been doing, the impact that they've had in their community.
Thank you.
So could you just talk me through your current org chart from top to bottom?
Sure. Roughly speaking, your estimate actually of who my direct reports is closer to right. I directly oversee probably closer to that 6 and 8, and there's for a chunk of that is the Fuse program team that I don't have direct oversight over. So I've got, there's myself at the top, and then I've got my assistant director, I've got my office manager, I've got an administrative assistant, our visitor's aide, the project director for SOC, the Fuse program manager. I think it is that 6. And then the Fuse program team is 4 people when it's fully staffed. So I've got my assistant director, my office manager, my administrative assistant, and my Fuse program manager are kind of my core administrative team.
Can you describe the Fuse program position?
Sure. The Fuse program, so the Fuse program manager is a therapist, so she also sees therapists, but we do have a separate Fuse counselor. We've got a peer coordinator, a peer specialist case manager, kind of a standard case manager, and then we've still got an open position for a registered nurse in the Fuse program as well.
And our next meeting is in August. You know, I mean, I feel like by then I would have a better understanding of it. Again, today, I'm looking at the bigger investment as opposed to right now what's here in front of us. And, you know, it's a lot to take in when you think about, you know, a commitment to a full-time employee at that pay grade where it will continue to increase over time. And there's still so much uncertainty.
Yeah.
So, thank you.
I think we have to balance that with the years-long concern about the money not being back in the community. And so I understand your position, but I think this proposal to hire this particular person, this particular role, is trying to answer the longstanding question of how do we get the money back into the community? And, you know, I feel like this is going to continue just to kick the can down the road and leave the money unspent. And so my concerns of pushing it back or delaying it is only going to exacerbate the ongoing problem of not putting the money back in the community, is my position.
I have 2 things. First of all, I do recognize that you weren't part of the committee last August, but I do believe there was an outline of the county's departments and the staffing and the cost around that. So we have been provided that. I don't remember it either. I just remember seeing it. But secondarily, from the provider side, I would echo, and I've been here since the very beginning, that there has been a frustration around not knowing how we could access funds, around not knowing what kinds of things we could ask for funds, sometimes around what was funded, honestly. And I think that some of that has been easing a little bit, but there is still concerns and frustrations on the provider side of where is this money and how do we do things with it. So from the provider side of things, and this type of role is someone, like this position is something we are used to interacting with, right? More often than not, when we are requesting funds from a grant body of some kind, there is a manager of some kind. There is a process that is out there with somebody who can provide technical assistance or someone who can talk through with your idea around what you're thinking and if that matches the grant purpose and such, and oversight, right? I mean, trust me, as a provider, I have been irritated with a few here and there, but that is a normal experience. My concern, I think, is a parallel to what Board Chair Johnson shared is if we don't move on this right? That perception of we're just kicking it down the can even longer is going to continue.
Thank you for that input. So is it your perception, you mentioned also the word process in this, and this is a similar conversation that we have going on with some funding that we have available to the public as well, that people just don't know how to find. And, that's helping uncover that we have some challenges with process, more so sometimes with this people that we have, that, our processes need to be designed to be more useful to the public and those that we are trying to help. So with that in mind, again, I'm just trying to reconcile the fact that we're also talking about then removing $100,000 from the budget that would be available to the people if we made the process easier so that they could get at the funding, and not just, year one, year two, but really in perpetuity. And, how do you strike that balance? What effort has been made to make that process simple so that people can know who to go to or where to go? And, as emerging technology, sometimes, these solutions can become less people dependent and more enabled by effective process design.
I think my only response back is, but you need people to design the process that have the bandwidth to do it. So that would be my concern,
Yeah.
is if we don't have something in place, it's just going to take that much longer.
I totally agree. And, that's where, again, even faster sometimes than the lead time to retain a full-time equivalent. There may be support service that you could, retain to design an effective process that may or may not be able to be operated with your existing staff if it's a good design and if it meets the need. And then in the long term, more of that money would get to the community and not less.
I do think that establishing part of the process is going to be a fundamental, starting point of this role. But the kind of administration, walking it through the approval process and the monitoring it to make sure that it is doing what it was intended to do is the bigger part of the job, that I'm not sure that there's an AI process that's going to be managing that. This is something that the accountability of the funding partners have been drilled in, and that having somebody who can ensure that accountability, I think, is crucial.
I'm not meaning to suggest that this could be replaced by someone using a large language model. So if I implied that, that was not my intent. And again, I thank you for your patience with me as I get up to speed and ask questions and do the best I can to contribute on this group. It sounds like that you have the support that you need to move forward with the vote, agnostic of my not quite being there yet. So thank you.
So forgive me and my poor understanding of Robert's rules. Do I have a motion? Oh, sorry, Kevin, go ahead.
You spoke a little bit ago about frustrations from the provider side. So certainly, on the funder side, one of the things as we look at how much has gone out to services from this particular part of the shared sales tax funding, obviously there's a building over there. We can go, hey, look, there's a building over there that wasn't there before. This is harder for us. And when we look at the however many years we've been at this, 8 or 9 years now, we look at the money that's gone out to programs versus the money that's gone out to staff. It is lopsided by a lot. And so the part of the scrutiny here for us, or at least for me, I can't speak to anybody else, is looking at that we've been paying staff, frankly, for years, and we haven't seen much money go out the door. And you're coming to us saying, but we need one more staff to get the money out the door. And just to kind of lay it there, generally that's a little bit hard. So, hesitancy on the funder part is we're more staff, but we've had staff and we haven't had it out the door. And we're talking about building process, which I appreciate. Somebody's got to start. and we have some of it. So when we're talking about hesitation and frustration, let's put it all out on the table. Is part of the accountability for us is, hey, there's bodies and no programs. And that's part of what I've had to answer to as well.
Sure.
Or I shouldn't say no, obviously, that's a gross exaggeration. So I don't mean to put that out there as truth or gospel.
Sure. Cassie?
To respond to that, we have had a cut in our staffing for this department in the last couple of years, and that is due to the movement of the triage program to a community service provider. So when we had at our largest number for this department, it was because we were running two different direct service programs. And so to say that the staff, you weren't seeing a product, they were running two very labor-intensive crisis system services in our community. One was the FUSE program, and the other was our triage center.
So just to follow up on that, I think, it's one thing to lift and shift, but really the leverage of the internal staff, I guess, is the optics that, I'm being questioned about too. So, thank you.
I think I would also just add that we have to also remember the other funds that were brought, we have to remember the other funds that have been brought to the county that maybe weren't spending county funds, but the SAMHSA grants, the other things that this department has been had brought to the county is going out to providers, but isn't spending county dollars for. So there's still been some support to programs through things, but maybe not spending of these dollars.
Some of my hesitancy is that, yes, we have had two very intensive direct service provider roles. And so I guess the point I'm trying to make is that when we sent money to the YWCA, the largest portion of that money, I'm guessing, went to staff to provide the services. Staff is essential to any of these kind of mental health services. And so I can understand the concerns about it looking like internal staff, but when we're providing a direct role, like in the FUSE program and in the triage, now that money was going to CHS, the intention is that they will take that over, and that will shift some of our grant funding. Will open up some of that funding in a couple of years. It already has.
Yeah. Yep.
Great. So, but that's part of it, is that when we talk about, I do want to be clear about when we're talking about internal staff, is that a large portion of the BHCC staff is our FUSE.
Is a program.
It is the program.
Is a community
It is
program.
providing services directly. And so that's getting into the weeds and nuance, but it is a reality that you're talking about. The money needs to be towards services that are improving the community, and we are with some of our internal staff doing that program. So I guess my point is that the money is going to go to people providing the services, whether that is internally or if that is something that we are sending directly to an organization in the community. It's going to go to people doing the work.
Do we have a motion to vote? Kevin, thank you. Do we do an everyone or roll call?
We can do either.
Or we'll just do it.
Okay.
All in favor, say aye.
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 Aye. All in, opposed, say nay. So noted.
With context, and thank you. I just would love to see us have the opportunity to explore the process first before we bring on a legacy cost that will take more money out of the ultimate recipients in the community.
I appreciate that, thank you. With 3 votes, the motion carries. And do we have any other pieces of business? Yes, Cassie?
I'd just like to make the clarification that then this action would be, this is an advisory group.
Correct.
And so this action then goes up to the executive committee of the county board for their approval next.
Thank you for that clarification. Do we have a motion to adjourn? Izzy?
Second.
Kevin? We are adjourned. Thank you.